So we presented results from the first 3 surveys on December 1st, World AIDS Day of 2016, from Zimbabwe, Malawi, and Zambia. And today, here at the IAS 2017 conference in Paris, we presented results from the 4th country, Swaziland. The other countries, the data will be forthcoming in the next few months. What we learned from the first 3 surveys, and I would say was again confirmed today with the results from Swaziland, is that the southern African countries are actually doing quite well with the 90-90-90 targets. They are very close to achieving the second and the third 90, very close to that 90 number. And in fact, in Swaziland, they have exceeded that third 90. It is 92% in Swaziland. So that means of those individuals who are HIV positive and aware of their diagnosis and reporting use of antiretroviral therapy, 92% of them have a viral load under 1,000 copies per ml. And I know you were just talking before with some vaccine people. I would say we don't need a vaccine to achieve 90-90-90. We're almost there in some of the most severely affected countries. Swaziland has had now for a number of years the highest HIV prevalence and highest HIV incidence of any country in the world. And I worked with the Ministry of Health and with CDC on a previous population-based HIV impact assessment in Swaziland 5 years ago. The surveys in Swaziland have the name SHIMS, the Swaziland HIV Incidence Measurement Survey, but they really are very much a part of the FIA project, particularly SHIMS 2 from 2016. The results that we presented today both laid out the SHIMS 2016 results and compared 2016 with 2011. And what we found was that in 5 years' time, during which the Ministry of Health has really done a fabulous job in scaling up HIV testing and treatment, incidence has dropped by almost half, and viral load suppression, which is a measure of ART coverage, has doubled. And it doubled from about 35% to 70% for viral load suppression. And 70% is basically where you want to be when you multiply out the 3 90 targets. 90 times 90 times 90 gets you to 73%. And Swaziland is at 73% when you look at the population with viral load suppression, regardless of awareness of treatment or reported use of antiretrovirals. For the first 3 countries, the biggest challenge was the first 90. And that was a surprise to me and to many of us. I didn't know that the first 90 was going to be the most challenging of the 3 90s. I would have predicted the third 90 was going to be the most challenging. But it looks like once people know their status, they are getting linked to care, started on treatment, they're adhering to their treatment, and a very substantial majority of them are achieving viral load suppression. Now, what I'm saying applies at a national level. When you start to drill down and look at subpopulations, what we find, again, over and over now in all 4 countries, the biggest challenge lies with the adolescents and young adults. And that's not really a surprise. That fits with what we know from other surveys and other types of studies. So the other thing we find when we drill down is that generally men have lower levels of awareness and treatment coverage and viral load suppression compared to women in all 4 countries. It's not a huge difference compared to, let's say, under 25 and over 25. So the bigger challenge is with the youth, and an additional challenge is men versus women. I think as we start to look more carefully at the data, in some cases we see geographic disparities where, let's say, viral load suppression is doing better in certain regions of a country compared to others. That's exactly the kind of data that we want the ministries of health to have, so they know, oh, we have to really put more resources into this part of the country compared to the other part, and I'm just generalizing, so I'm not saying northern or southern. I can say actually for Zimbabwe, Malawi, and Zambia, which are 3 contiguous countries in southern Africa, and a long time ago they used to be one federation, they all had higher rates of HIV prevalence in the southern regions of the country, and perhaps that's because of their proximity to South Africa. That may be the theme. That's just my speculation. Our surveys come up with indicators and measures, but we don't have reasons. We can interpret and come up with speculations, but the data are the data.